Arthritis is an umbrella term for over 200 types of diseases. Osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, fibromyalgia, lupus, gout, psoriatic arthritis are covered under this. Arthritis means just it is an inflammation of the joints. About 30% of adults have arthritis. Incidence increases with age. Radiographic changes are seen over the age of 60 years. In that, 50% are persistently symptomatic. Obesity increases the mechanical stress in a weight-bearing joint. It has been strongly linked to osteoarthritis of the knees, and the obese patients are more likely to disability development. Osteoarthritis in old age is not only a physical disability, it also causes a psychosocial and socioeconomic problem to the human being. Treatment of osteoarthritis: exercise, weight control, rest and joint care, pain relief techniques, medicines, alternative therapies, education, and surgery. We will discuss each one in detail. Rest and joint care. Rest and joint care means not taking rest. You have to take rest from the painful activities. You have to avoid movement that is lost, like squatting. If you have got a difficulty in squatting, avoid it. If you have got a difficulty in stair climbing, avoid it. Avoid low beds, chairs, toilets. Elevate them when possible. Wear properly fitted shoes with a well cushioned soles. Avoid continuous standing, walking, and stair climbing for longer period. You can do everything just few minutes less. Use ramps or elevators. If you must use stairs, take them one at a time, stopping occasionally to rest. Coming to the physical aids. Walking stick reduces the hip loading by 20 to 30%. It reduces the knee pain and improves the function, and most importantly, it prevents the falls in old age. But this knee braces and shoes, wedges have got a very limited role in knee pain. Non-drug pain relief. Warm towels, hot packs, warm bath, cold packs in some cases, water therapy in heated pool or whirlpool can be tried. Coming to the medicines. The goal of giving medicine is to eliminate or reduce the pain, improve function. But you have to consider intensity of pain and potential side effects of medicines. In medicines, paracetamol is a safer tablet. It relieves the pain but does not reduce swelling, does not irritate the stomach, less long-term side effects. Should be used cautiously with the liver disorders and heavy alcoholics. Sandler et al. In 1989 reported that 30% of osteoarthritis patients with a long-term ingestion of NSAIDs and acetaminophen developed a chronic renal disease. We have to be very careful in prescribing painkiller tablets in patients, because once you prescribe, they will continue to take the medications over the counter. Coming to the intra-articular injections. We can give intra-articular injections and it is safe and effective, but we have to take all the safety measures. Coming to the surgical treatment options, there are two types of options are there. One is joint preserving operations, other is arthroplasty options. In joint preserving options, arthroscopy, cartilage transplantation, osteotomy. In arthroplasty, you can do a partial knee replacement or a complete knee replacement. Arthroscopic lavas. Arthroscopic lavas and debridement for osteoarthritis of the knee. In evidence-based analysis, there is a very poor quality evidence on the effectiveness of debridement with a partial meniscectomy in case of a meniscal tears in osteoarthritis of the knee. It has got a very limited role in osteoarthritis. Coming to the osteotomy, it is a very good surgical procedure for patients younger than 60-year-old, and if only one compartment is affected, it gives an excellent pain relief and it is a long-lasting relief. In this photo, you can see a high table osteotomy patient sitting on the floor. This is a photo published in Journal of Arthroscopy and Related Surgery in January 2009. Patients sitting on the floor after a high table osteotomy. Total knee replacement. It It is indicated when pain is not responding to medical treatment or a large amount of analgesic requirement is there or a severe restrictions of daily activities and if the deformity is progressive and severe. Before doing total knee replacement, pre-operative evaluation is very important. To take a proper medical history, complete physical examination, blood and urine test, X-ray to estimate the extent of damage and deformity, assessment of comorbidity is must. Coming to the total knee replacement. Total knee replacement is a last surgical option. In this, we are not going to replace complete knee joint. It is only surface of the knee joint. The cartilage part of the knee joint is replaced. Almost 8 to 9 millimeter bone and cartilage from the femur, distal end of the femur, and same thickness bone from the proximal end of the tibia is removed and replaced with a cap. And this surgery is done under aseptic precautions. Sterility of the operation theatre and cleanliness of the staff is very important to prevent the infection. You can see the artificial joint fixing to the bone. This is how it looks after fixation. These are the implants and X-rays after surgery. This patient presented with very severe osteoarthritis of the both knees. You can see almost 35 to 40 degrees of the varus deformity. She had a difficulty in walking. See, we did a both sides knee replacement in a single stage. You can see complete correction and leg is straight. One more patient with a very severe bent legs and she had very severe pain, was not able to walk. This is a post-operative X-ray. You can see the joint fixed to the bone and legs are straight. Osteoarthritis is a common condition. It affects almost everybody in their lifetime and some people are symptomatic, some are asymptomatic. We have to try all the non-surgical options before thinking of surgery, and if patient is not responding to painkiller tablets, physiotherapy, exercise, all other options, then we have to consider the surgery, that is a knee replacement in older people and corrective surgery in the younger patients. If done in selected patients, the knee replacement gives a very good result.